Welcome to the third episode of What in the Health with your co-hosts, Eric, Rena, and Fatiha. We're really excited to present our third episode, Patient Advocacy. Today, we'll be talking about how patients can best advocate for themselves while interacting with healthcare providers. Our guest expert for this episode is Dr. Kathryn McDonald, a Bloomberg Distinguished Professor with an appointment at the Hopkins School of Nursing and other schools affiliated with Johns Hopkins. Kathy's latest research project has been a diagnostic errors and disparities study in which she examines how a patient's age, race, and sex may contribute to errors in diagnosis and disparities in patient outcomes. Through this study, Kathy would like to understand how visible factors such as race, gender, and age put the youth, women, and African American populations at risk for misdiagnosis of infections, cancer, and cardiovascular issues. Through our conversation with Kathy, we learned how patients can remain at the center of improving healthcare delivery. In this episode, we hope that you can understand aspects of patient safety and think about how you can better advocate for yourself in healthcare settings.
To start, we want to introduce how the term visible factors can play a role in our healthcare system. We asked Kathy what this term means to her and how these factors can affect patient outcomes.
So the question ends up being, is there something about the way I look when I walk into an encounter or when I land in a hospital bed or whatever that might influence the way that somebody else assesses what could be going wrong with me? And what we're hearing from patients and family members when we talk to them, and they have different of these visible factors, things that could potentially influence their care. We hear from them their perceptions of, the doctors thought my child was too young to have this particular serious illness, or and that could be reasonable in many cases.
Being aware of visible factors is important, but it's also important to know how they actually play a role in healthcare disparities. Here's what Kathy had to say about how these types of problems can materialize.
That assumption that's either based on good clinical data or other assumptions, maybe going into that implicit biases, incorrect data about whether somebody who is African American, say, would be at more or less risk. There can be incorrect assumptions based on past, published studies that are incorrect about elevated risk based on, something that was thought to be connected to, say, race, that's not connected, because the biology of race isn't driving things. There's not a biology of race. So there's a lot that goes into where these risks could arise, and we just try to listen to patients to generate our hypotheses.
It's important to recognize that there is an abundance of research studies published and peer-reviewed, including Kathy's research, that proves visible factors like your race, your gender, your age, your ethnicity can have an impact on your experience in healthcare settings, whether that be the actual patient-physician interaction, the diagnosis, the follow-up, whatever process you're looking at, within healthcare delivery. Recognizing that, I think it's just fascinating to me that, at least from my experiences, often we kind of second guess ourselves and how we want to approach addressing these visible factors as a patient. And what I mean by that specifically is I feel like often, we see healthcare professionals as almost, for a lack of a better term, a paternal figure, right? Like they have all the knowledge, all the years of training, the specialties to tell me what's wrong or even what's right with my body. But the fact that bringing up your race, your age, or even bringing up conversations of like, I'm a Asian American woman, how can that potentially affect my diagnosis? I feel like in many settings it's kind of taboo almost. So often I feel like there are a lot of patients who might have an inkling that maybe there's an unconscious bias present in my diagnosis relating to how I look on the outside, but they don't exactly know how to address it because patients just aren't made aware of how specifically those factors affect what process or what aspect within healthcare delivery. So I'd be curious to just know, how can we actually validate patients' experiences and empower them to think about, oh, maybe there are visible factors about myself that could potentially be affecting my care?
Yeah, so to add on to that, I recently read a study that the quality of care was for Black and poor populations was significantly lower. And I'm not sure what quality of care was in the study, but it was reported as lower. And in the same study, they also said that minorities were less likely to receive adequate diagnostic tests and even given the right therapeutic drugs. So, these visible factors not only impact how you talk with your doctor, but also what you get from them for your treatment.
And I almost feel like bringing up the conversation of race, gender, age, any aspect of your visible factors can sometimes be an awkward conversation, whether it's a patient bringing it up to a physician or even a conversation between two physicians. I was recently facilitating a workshop for Kathy's project, and we had members from a patient advisory board and a research advisory board come together to kind of talk about the experiences with diagnostic errors, diagnostic disparities, and how visible factors kind of relates to everything. And there is this common theme of, we know race affects how you receive medical care, but we don't really know how to approach this topic with patients. We don't know if we should expect patients to be completely vulnerable and address all these things on their end. We don't know if we should bring it up during a conversation if they hadn't thought about it, or if there should be another kind of procedure to make sure visible factors is embedded in how healthcare is delivered. But I think there's a lot of ifs and buts and kind of uncertainty around it. But I think my point is that it's really important for patients to know that if they believe their visible factors influence healthcare, well, it's true. But I think they have a right to know specifically how. And so many of the research studies that are available just aren't accessible to the average patient to read and be like, oh, I know exactly like what factors of the healthcare process I should pay attention to as a Black patient, as an Asian patient. So I would just be curious to know if you guys have any thoughts about that. Again, I feel like I've read a lot from a historical, cultural lens about all the inequities in healthcare, but I've just personally come across very few resources that are like, we know that these are problems and this is how we need to support you. And I'm pretty sure this is a topic that will come up later in the discussion about how patients can advocate for themselves.
Awareness is kind of step one. Like, these are problems that exist. These are things you as a patient, unfortunately, you have to be aware of if you want to kind of protect yourself and look out for your own medical care. And at the same time, I don't know what can fix this, right? Because there's not one answer, there's not one solution, right? It's like, because kind of like you're saying, it's not like you can put all the blame or all the responsibility on a doctor. It's not like you can put all the responsibility on a patient. There needs to be a relationship. There needs to be people working together to help address the problems when they come up. And so, yeah, it's almost hard to get like a one size fits all pamphlet, but it's also really, it's not a good idea to just kind of sit and let the things be the way they are too.
For me personally, I feel like coupled with unconscious bias, medical education plays a really big role in how you approach, just the healthcare of marginalized population, whether or not, for example, if you're a woman of color, if you're a child, if you belong to the LGBTQ plus community. So I think, I've read a lot of stories about how, as a result of inadequate medical education. There are a lot of med students who truly believe Black people feel less pain than white people. Or I've also seen some dermatologists online argue about how they've never seen certain skin conditions come up on Black skin, and they've only seen it in white skin through textbook. And now there's a bunch of softwares that are coming in to kind of solve the issue. I can't think of the software off the top of my head. Oh yeah, it's called Visual DX. Like, that is a software that's been created where if you are able to put in a bunch of symptoms and like skin color, it'll show you like a condition across skin colors to like mitigate the gap. But anyways, sorry for the tangent. I think, Rena, as our resident pre-med student, I would love to just get your insight on how you think medical education is tackling the impact of visible factors on healthcare.
To talk about medical education, I mean, I unfortunately don't know a lot of what goes on, but I feel like now people are trying to incorporate some more like diversity-based courses just to kind of get people aware of what's going on. And I think, your health has so much to do with a lot outside the doctor's office, right? It's, do you have education? Do you have access to health insurance? Do you have access to good food? And I feel like, sometimes in the medical education, we're not taught, like what happens when somebody walks in the door and they don't have enough money for food, right? I feel like then people just kind of reach this like stopping point and they don't really know like how to treat for a person who's in a vastly different condition than they are. And maybe reaching a solution to that just has to come from experience, right? Just getting different kinds of people in through the doors for practicing residents or students. That may be one way, but yeah, I don't really know. It's a huge problem, and there's a lot of other entities involved in healthcare, again, outside of just the hospital or outside the doctor's office, and everything is just so connected. And I agree with you guys, there's probably not one answer to fixing this in the medical field or in medical schools.
I like that Kathy brought up those kind of previously published studies that try and connect things to race, kind of that biology of race. I feel like that was such an interesting, like, just thinking about, like, if you have a doctor who's kind of older, like they probably went to medical school, maybe even learned about stuff like this, like in school, and were taught it. And obviously there's things like continuing education and stuff to try and, keep people up to date on what's really science and what's not. But like yeah, like you said, there are medical students now who believe that Black people don't feel pain the same way or feel less pain. Like there are people who will probably explicitly say they believe women exaggerate pain or something like that. Like there are a lot of explicit biases. And then there's the other problem of the implicit biases, right? Like the people who wouldn't say those things out loud, but when maybe a Black person comes into their office, they maybe downplay what they're being told, even if they're not really realizing they're doing it. And that's really tricky, because how do we tackle something when people don't even realize they're doing it? But like you're saying, I think education is a huge part of it. And really, hopefully we start to see that change.
Yeah, and that's why culturally responsive and culturally responsible education is so incredibly important to make sure we have healthcare professionals who have a nuanced understanding of all the aspects in one's life that could affect their health. Like, Reno, you were bringing up basically social determinants of health, right? How does access to food, the zip code that you live in, your interpersonal relationships, amongst other things in your day-to-day life, affect your health? And Eric, you were mentioning implicit biases and explicit biases. And I think in order to couple the two together to make sure that a healthcare professional is trying their best to be objective about healthcare, it's important that they are constantly acknowledging biases that are structurally embedded in our system day to day, or else something is just going to fall through the cracks. And I think I would really be interested in learning more about, are there specific certifications or programs available to help doctors, nurses, and other healthcare professionals kind of learn more about different cultures and beliefs and demographics, or if that's more of like a self-taught journey, really?
The other day, I was looking at different medical schools and what they see valuable in their applicants. And one of the big things across a lot of these medical schools, they're looking for students who are diverse or have experience working with diverse populations. But then at the same time, like you go to undergrad and sometimes it's not very accessible to work with a diverse population, especially like depending on where you are, right? Maybe your college doesn't offer different, diversity classes, or maybe you live in an area that is not very diverse and then you don't get this experience working with different people. And then, you apply to medical school and they're already looking for these things that maybe you have no experience in. And then maybe you get into medical school and then it's like, well, how am I supposed to work with all these diverse patients now? I've never had experience with it before. So maybe it's even going before medical education and promoting it in early schooling, in undergrad, in high school, or whatever.
To point out, like we can point the blame at like med school curriculums, but like that's, what is that, 4 years of your life? Like, I don't know. There are other places in life where the systems can kind of prepare our medical providers. Even think about like nurses who wouldn't go to a big med school, they spend less time studying stuff. Like, it's just important that at all levels, people who are going to go in the medical field are provided, opportunities, to interact with all different people. You should have a breadth of experience before you even go to med school. I think that makes sense. And to spread the responsibility, this is, if it's a systemic problem, then it needs a systemic solution. And that means there's a lot of people that need to change, not just one. Yeah, and like we're saying, if we're talking about spreading the responsibility between multiple parties, I think it's important. Like, we can talk all about preparing physicians, preparing nurses, preparing people in the medical field to deal with these problems, but that's not the only way to solve this. Again, right? A doctor can't read a patient's mind. If the patient isn't communicating with them, then there's another problem there. So it needs to be a relationship and between the doctor and patient, and there is some responsibility on both sides.
Understanding that visible aspects of one's identity can impact how they receive healthcare, we asked Kathy about the mindset patients often have that can influence how they interact with physicians.
I'm the one walking around in my body, and I'm the one who's going to live with whatever we decide to do next. So can you tell me more about how you're thinking about this? I was thinking about it this way. Can you help me think about whether that's pertinent here?
So before, we touched a little bit on the patient's perspective, but Kathy reminded us that physicians are also dealing with barriers that make it difficult to effectively address the needs of their patients, regardless of their visible factors.
There's so many new ways of thinking about how to think about primary care that my primary care colleagues are very busy right now sorting out the possibilities. There's a much wider range of possibilities in terms of how to organize so that it can work from the clinical team's perspective, and so it can work from the patient's perspective. But there's a lot more to be done to try to design the system around as much around what the patient needs as what the clinical team needs, and that it's a clinical team as opposed to one doctor at a time.
There's something to be said about validating a patient's lived experience. And my mom, I have permission to share this story, by the way. I feel like her experience perfectly highlights the value of the patient side of Kathy's quote, while also being empathetic towards what physicians have to deal with for her day-to-day life. So my mom, she has been having low back pains forever, right? By forever, I mean like a year and a half. And she has been going to her primary care physician or PCP every 3 months. And she'll be like, everything is fine, but I have this intense lower back pain and I don't know what to do about it. And the doctor was like, let's try PT. Let's take you to an orthopedic specialist, kind of all these different options of treatment. And my mom, every appointment, would have me fight with the doctor being like, no, I think there's something wrong with my kidneys. And I just think that because I have this family history of kidney disease, it caused my dad to pass away years ago. It's something that runs in my family. Like, can you just check my kidneys, please? And the reason why I'm talking is because I'm her primary caretaker and translator. Anyways, so every 3 months, we have this intense fight basically at the doctor's office. And my mom's like, I'm not going to physical therapy. I'm not going to an orthopedic specialist. I need a second opinion. So at the end of the day, like a year and a half into this pain that she's having, she goes to get a second opinion finally, because I'm just nudging her. I'm like, let's just try something new. So the doctor's like, let's get an MRI done of the kidney area, because she was so insistent. And lo and behold, they found something, right, abnormal going on around the kidneys. Now, was that just kind of like a fluke, or was my mom right the whole time? I don't know. Like, I really don't know. But I think just that experience, right? When Kathy is like, I'm the one walking around in my body, like my mom was the one with the lower back pain, right? Like, as someone who wasn't experiencing that pain, whether that be me or the physician or the nurse, it's really easy to be like, no, it's this, this, and this. But in every interaction, for the most part, they just weren't considerate of what she was saying. But I think, at first I was just really like livid. I was like, how do you miss something like this? If it's been going on for a year. But I'm really empathetic towards the physician side, right? Because when I look at the structure of like her primary care physician, the doctor is seeing patients back to back, right? And her PCP has such limited health history information from her, and it's so fragmented that it's hard to put two and two together if she's explaining her family history and it's not in the chart, and there's medications that are missing and whatnot. Or, if the PCP is communicating with like multiple specialists, it's really easy for information to fall through the cracks. And I feel like the structure of just data collection and how health information is stored isn't effective enough for there to be time for an accurate and timely diagnosis. But, I guess that's me giving a benefit of the doubt, because part of me is like, oh, this is an instance of visible factors affecting how you receive your diagnosis, right? Like, I think seeing her as an Asian woman, an immigrant who's in her middle age, knowing that she can't speak English, I hypothesize that also had something to do with it, right? Like, I'm translating these symptoms for her. There could be a possibility that the doctor was like, I don't really trust it, because it's a third party telling me these symptoms. I say all this to be like, yes, this kind of really proves Kathy's point of her quotes on the patient side and the physician side.
Yeah, I really do think that's a great example of like why this is so hard for both sides. Like on the patient side, there's a lot of reasons people don't want to bring things up. Like it can be, I think one of the interesting things is just like your mother's medical history is kind of fragmented and wasn't necessarily given to the doctor in full, or maybe as full as it exists somewhere else. But and so it's like this system isn't really working for all different types of people from all different backgrounds, and I think that's really interesting. Different reasons someone on the patient side like might not want to be bringing things up. Like maybe it's pretty vulnerable, to say I'm feeling this way, or I think I have this and that, and it could be scary too. You might feel like you're going to get shut down, or what if you're wrong and then the doctor thinks you're stupid or you're crazy, and some people just don't. Some people feel like advocating for yourself is being pushy or something. They feel bad about it. They feel like the doctor knows better than me. Why should I input anything? But kind of Fatia's story shows, people are very busy. People are very the medical environment can be very hectic. Again, I said it before, the doctors can't read your mind, and they can't know everything about you. Like Kathy said, it's your body. You know it best. You know your history best. It's your responsibility when the moment's right to say something and say, hey, I've been dealing with this, or I have this in my family, and bring it up. And then at that point, it's the doctor's responsibility to kind of take it seriously too, which I think it was really important that Fatia is pointing out that didn't really happen at first. But yeah, I really like that we're bringing up this nuance, because I think there's a lot of people who will try and place the blame on one side. Patients, it's their body, they need to take care of it, right? It's their job. But and then there's other people who say the doctors are experts, it's their job. But the reality is it's nuanced, it's hard for both sides, and we need to work together.
I'm really glad you brought up the point of feeling intimidated around your doctor, because I feel like that happens all the time. I've even felt it with my own doctor. And I think sometimes that gets into the doctor's head, and not to like bash on all doctors here, but I have met throughout my years of, volunteering and doing community service with the healthcare industry, you see a lot of people where their ego really gets to their head, and it's just not good, because then that means they feel so confident that they're right that they don't even listen to their patients anymore. I feel like that happens a lot more than we think. And again, maybe that's a fault in the education system. I don't know. But yeah, I think it is really scary to say, hey, I think you're wrong, or hey, can I get another test? It's really scary to say that. And especially if the doctor is like, no, I'm right and you're wrong, like that makes you feel awful. And so I think, yeah, like the patient physician interaction has so many layers to it. And it's not all about like, when I talk to my doctor, do I feel good inside? No, it's really about like, am I getting the care and the tests that I need? Am I getting the right medications? It's really complicated. And especially like Kathy's point about communication between different entities. I think I read somewhere that like poor communication is one of the leading causes of preventable deaths in hospitals. And that's not just errors in communication between the patient and the physician, it's also physician to physician, it's physician to nurse, it's hospital to hospital, clinic to clinic, right? There's so many layers to this. And yeah, it's so hard to communicate all that information, especially what you said, Fatia, about like the family history and the medications. Like, it's so complicated. I don't really know like how to fix it. And yeah, Kathy really brought up some great points about, like there needs to be some kind of system to better organize all this information.
Yeah, and not to complicate further the topic at hand, but Rita, you were mentioning how sometimes it's really intimidating to go ask your provider for a second opinion, right? And there's this beautiful piece called health insurance, right? Are they even going to cover the additional round of tests and examinations, right? Like if I got an MRI done by my primary care physician and I'm like, I don't agree with this, I'm going to go get a second opinion. And you build up the courage to get a second opinion, and your physician's like, yeah, sure, let me refer you somewhere. Or, you find your own PCP that you want to get another opinion from, and then you go to get another MRI and your insurance is like, sorry, we can't cover it. You just had an MRI like a week ago. That's another structural issue that's further preventing you from getting an accurate and timely diagnosis. And I think health insurance is as a topic of its own, really, right? There's no way we could do it justice in this short little segment for the podcast, especially for the topic at hand. But, that is something I wanted to mention.
Yeah, and I mean it's true. It does complicate it, right? When money is involved, everything becomes more complicated, especially in the society we live in, where the same visible factors that are hurting you in the doctor's office are the same ones that can be hurting you in your career, your job, the economic field. But I wanted to bring up something Rena said too. Rena kind of brought up language in a bit, like the way it can feel hard and like aggressive to say like, hey, you're wrong. And what if the doctor says like, hey, you're wrong? And it's like, hopefully that's not the conversation that's going on, right? Like, I think it's we can come here and we can say like, hey, advocate for yourself in your doctor's office, and you might have a picture of what that is, but the reality is it takes a lot of different forms. But it should be a conversation like any other with your doctor. Say, hey, I know you said this, but do you know that I have a history of this? Or have you considered this diagnosis? Is there a doctor who I could see who might know more about this thing? Like it doesn't have to be, hey, you said this, but you're crazy. And And so, yeah, so it is hard, but it doesn't have to be this crazy complicated conversation. It doesn't have to be this crazy aggressive conversation. Just, we're not all friendly with our doctors, but still, they're people, they're professionals. Just, say something, talk to them, and it can go a long way in just starting the conversation.
I'm glad you bring that up because at the end of the day, if they are a good doctor and they truly care about you, it is their job to make sure that your health is going in the right direction, right? It's their, if you have any questions, if you have concerns, it's their job to address it. And if they aren't or they refuse to, that is not your fault. That is their fault for sure because they are not supposed to do that. And again, like there are many different ways to talk to your doctor about concerns that you may have. Maybe they're really pushy and they think that they know what's best for you. That is actually one way that doctors can talk to their patients is they're like this paternalistic figure. They encourage you that their course of action is the right one and that you should take it. But that's not the only one. And if you don't like how your doctor is communicating to you, it's their job to listen to your needs and concerns and act on them.
I am curious to know how you guys feel about patients researching their symptoms and experiences online before they go visit a healthcare professional. And I mentioned that because, Eric, you were mentioning earlier that not all interactions have to be super aggressive, and you're allowed to be able to have questions and ask about, what you think is going on with your health. And I feel like it's a very polarizing topic, surprisingly to me, because I've talked to people who are like, no, patients should not be using Mayo Clinic and WebMD to Google their symptoms because they come to such extreme conclusions and it's just never good for anybody involved and it's a hassle. And then I've met people from the other end of the spectrum who are like, patients totally have the right to use the internet and ask questions based on what they read online and feel a little bit more empowered to talk about their health. And I'm sure there's a happy medium between the two sides of the spectrum somewhere, but I would love to hear your opinions on it.
If it's like, I have a headache and WebMD says I have cancer, like, that's that's crossing a line. But I mean, I think people should kind of look into it at first. I mean, they don't have to, but if they kind of have an idea of what their problems are and they want to talk about it with their doctor, I think that's great because, that shows that you're kind of taking control of your health and you're like wanting to do something about it. But again, like if your doctor gets like upset at you for researching beforehand, I don't know why they should be. They should be there to listen to you. And if you're truly concerned about your headache being cancer, then I think they should take the time to sit with you and talk with you, what the tests are, what the potential next steps are. Like, I don't think a doctor should just say, no, you're not allowed to look at your own problems before you come into my door. Like, so yeah, I guess I'm like somewhere in the middle.
Yeah, I think it's important to bring up because I think this is something that makes a lot of people hesitant to speak up is they kind of hear about this stereotype and they're scared to kind of become it or kind of be this nuisance. But I mean, there's a reason these websites exist, right? Like there's a reason having more information out there is good. Like it gives people, because sometimes you're reading like a Mayo Clinic, a WebMD thing, and you're like reading down the symptoms and you're like this has to be it. And maybe it's something your doctor didn't consider. And you go and you bring it to him and maybe that's right. But I think, maybe this is just my view, but like it has to be conversations, right? It needs to be conversation. Conversations are two-way. It's a two-way exchange, right? The conversation isn't one person just dominating. That's, so if the patient is going to go in there and say, hey, I looked this up on WebMD. Can you just give me the prescription? Because I already know what I have, or, hey, I want to like, this is what I have. Like, I know I'm going to go do these tests now. Is that good? Like that's not a conversation. And neither is it a conversation if someone goes, hey, I think I have these. And doctor goes, no, you don't. A conversation is two-way. You should bring that to your doctor. Your doctor should talk about it with you. You should talk about it with each other. And that's kind of the ideal. So I think it's good that there are these ways to research. It kind of outsources some of the doctor's job, Maybe it gets you thinking about what type of symptoms you're having. Maybe it gives you ideas about what things could be wrong, or what parts of the body might be involved, and you can bring those up, and it may save your doctor time. And so there are definitely benefits to it, and I hope people are doing research, for their own sake, and bringing it up appropriately. Yeah, is what I'd say.
In light of all the nuances within patient-physician interactions, understanding patient advocacy and how professionals in the field are advancing this topic helps to improve experiences in healthcare settings.
When we talked to Kathy about potential ways to advocate for ourselves, one thing she suggested was getting another opinion from a different doctor regarding a diagnosis or treatment.
I think what I hear from them and think is important is the idea of a second opinion is always okay. So if you're seeing a provider, a doctor, a nurse practitioner, and concerned that not everything is being explored, whether it's diagnostic or managing a health concern, there's often insurance does allow for you to go get a second opinion from another doctor. And so, understanding that there could be barriers that are economic, that would need to be overcome and can be in many cases. But there's just the barrier of not knowing that it's okay to go ask, to go to another provider for that second opinion.
Another thing that's important to know is that patients have legal protections in the medical space. Kathy discussed some of the work being done in the legal field to help patients get their needs met.
You've been acquainted with Helen Haskell, Fadia, and she, like other patient and family advocates who've experienced some, significant harm from the healthcare system, often work to change the legal environment to add more protections for the next patient.
I think one of the things that stuck out to me most when we were talking about this was kind of how simple it was. Like she said, just getting a second opinion, like that's a way to advocate for yourself. Looking at medical records was something she brought up explicitly elsewhere in the interview. Like just being able to access your own medical records and like look at your medical history. Like these are just like very simple and basic things, but they give you as the patient like a lot of power. And I think it's something we don't always realize, that we do have power in the medical space. Like Rena was saying earlier, like we tend to feel intimidated because there's an expert here and you're not an expert. But in the eyes of the law, like you have a lot of the power. You're the one who kind of gets to say, like, here's what I need, here's what I want, here's what's happening. And like we've kind of been saying, it's like it's your doctor's job to kind of serve you in that and also advise you. But I think as we become more aware of like what these things are and how we can leverage them to protect ourselves and advocate for ourselves, they can kind of become more commonplace for us, and that we can use them more and pretty effectively.
I also think in terms of just how patients can advocate for themselves, something that I really didn't know existed until I worked and spoke with Kathy is that there is such thing as patient advocates, where if you are unable to advocate for yourself for whatever reason, there are incredible support systems available for you to access those kind of resources, to have someone either come to those appointments with you or help facilitate communication with the healthcare provider to make sure you are getting the healthcare that you deserve. So for example, there's a company called Gray Zone Health. Just looking at their website right now, they say that they have professional patient advocates that serve patients both virtually and in person, specifically helping patients with rare and complex medical conditions. So they have patient advocates that are customized to patient experiences for support. Kathy had mentioned Helen Haskell, who is doing incredible work in the field of diagnostic errors by really helping to change the legal environment. And she and others kind of comprise patient and family advocates to support others through all of their kind of health conditions. And I just didn't know that these resources were available until really a couple months ago.
I think hearing about the legal advocacy was really refreshing because I know in certain medical procedures, especially serious ones, you have to sign something that says, you cannot like sue the doctor if they make a mistake or something. And that's also to protect the doctors. We have medical malpractice laws for a reason, and I think advocating legally is so important in this field because sometimes the doctor shouldn't be protected legally. And if we're tying this back to the visible factors and everything, if they deliberately do something wrong, then there is some legal support out there. And so it was really nice to hear about the work being done in terms of that.
Ultimately, we talked about multiple ways patients can advocate for themselves in healthcare settings. And we also talked about factors that can influence healthcare delivery from both a patient and provider side. And although a lot of these methods and conversations may be useful, Kathy recognized that in an ideal medical setting, patients shouldn't have to feel like they have to speak out in order to have their concerns addressed.
Anyway, this epiphany was, well, actually, though, if some problems in the healthcare system end up playing out that family members and patients have to be so worried that they have to, advocate so much, that extra heightened advocacy and extra heightened concern has a real downside too.
This was a really interesting point because I think all the time we hear encouragement that we should speak up for ourselves. And then it's interesting to hear this perspective that, the fact that we need to in the first place is kind of problematic. If we try to adopt a one-size-fits-all approach to eliminate patient advocacy, that might cause a whole set of other problems. We mentioned earlier, there are different ways that you can talk to your doctor. And if, we adopt just one way that we think that works, that might not work for everyone. So even though this point about how patient advocacy, the fact that we need it, maybe that's a problem, I still think no matter what, it's going to stick around, and maybe for a good reason.
Yeah, I think the bottom line of Kathy's comment here is that you should be able to go to the doctor's office and feel safe and feel cared for and feel like they're going to address your problem. When you go to any business, any place, you want to feel that way. And the reality is that a lot of people go into the doctor's office feeling very anxious, feeling very worried. They feel, we're talking about visible factors, they have to think. They go into the doctor's office, what is this guy thinking about me right now? What is this woman thinking about me right now? And also like thinking, if I screw up, if I don't bring up something, will I not get the treatment I need? Going into a doctor's office feeling like there's so much responsibility on you and so much concern about these other things out of your control that make you feel like your health is at risk. Meanwhile, you're trying to get help. That's the problem. I really think that gets highlighted here, or I think that's the problem. That's the takeaway that should come from this. Because you're totally right, Rena. Like, patients need to say stuff. There's a reason, like we've been saying, it needs to be a conversation. It can't be a one-way thing. But at the same time, we shouldn't have to kind of be defensive, right? Because the reality is there are a lot of doctors out there who aren't doing their job perfectly. Everyone's not doing their job perfectly, but there's a lot of doctors out there who are kind of doing worse than acceptable, and so there does need to be a level of defensiveness, and that's not really what we want in the medical field. And I think you're right that it's here to stay. But it's something to work towards. I think that's true too.
I know that just throughout this entire episode, we've touched on a lot of really heavy topics that could dishearten someone, especially people who are struggling to get the healthcare that they really need to make sure that it's an accurate and timely diagnosis. But I think it's important to highlight that research is being done in this field constantly to better improve healthcare and healthcare delivery. There's a whole society called SITM, or the Society to Improve Diagnosis in Medicine, that's really working hard to make patients the center of healthcare delivery and really address a lot of the gaps that we've talked about in this episode. And I think it's really worthwhile to highlight some of the work Kathy has been doing in the field so that you as our audience are left with somewhat of a hopeful sense of knowing that change is coming to whatever experience you may have related to while listening to us throughout this episode. So we just wanted to take a moment to let Kathy talk about what she's been doing in the field and what her goals are.
The work that I've done a lot more of is trying to measure safety or measure quality, and use those measures as something that can be comparative between, like say hospitals that are similar. One hospital is performing better or worse than another hospital on a particular measure. So the idea then with having measures is that you would see where there's a hospital or whatever healthcare entity that's not doing, that's doing substantially worse. And so find out from the ones that are doing substantially better what they're doing. And it's kind of a continual like raising the bar, keep raising the bar, get the quality higher, get the safety higher, and utilize, any knowledge we have to make that so.
Ultimately, we hope that this episode empowered you to understand aspects of patient safety and encouraged you to think about how you can better advocate for yourself in healthcare settings. For more information about Kathy's study or patient advocacy, please visit our website withthepodcast.com. To share your thoughts and interact with us, follow us on Instagram at with_the podcast. We appreciate your support immensely. Thank you to Dr. Kathryn McDonald for taking the time to talk with us. We hope you will join us for our next podcast episode.